Alright, so I'm reviewing my MAR and I see my patient Millie. She has some medications due. She has furosemide 40 milligrams IV push, and she has ketorolac 15 milligrams IV push. And I also heard that she's maybe having some pain, so she does have hydromorphone 1 milligram IV push PRN. So we're going to go in there and see what she needs. So I'm going to enter the room now. I'm gathering my supplies for what she may need. I'm entering the room. Hi Millie, my name's Connor. I'm going to be your nurse today. How are you doing? Good. Are you having any pain? Okay, you're having a 7 out of 10. Can I get your name and date of birth? Okay, I'm just washing my hands. I'm providing privacy as well. Alright, so you have an allergy to opioids, okay? So on the MAR, I see that you have hydromorphone, but that's an opioid, so we're gonna call the provider and let them know that you're allergic to that, so I'm not gonna give you that. But that is the medication that I would usually give since you're having a 7 out of 10 pain, which is pretty severe. But I do have ketorolac and furosemide still, so I'm going to give you those. And ketorolac will actually help with your pain as well. So we'll draw that up for you, okay? So I'm just going to grab some gloves here. And I'm going to just draw my medications quick, okay? Alright, so while I'm drawing on my medications, I'm doing my first medication check against the MAR. So I'm looking for right medication, right patient, right medication, right dose, right route, right time, right reason, right to refuse, and right allergies. So like we saw, allergies, that's why we can't give hydromorphone. So first I'm going to draw up ketorolac, and that is, we're looking for 15 milligrams, and on here it's 30 milligrams per milliliter, so we're going to drop a half of a milliliter. So I'm first going to inject half a milliliter of air into my vial. Then I'm going to drop a half mil. Take that out. Just make sure that I get all these air bubbles out. Which I drew up a little extra because I knew there was an air bubble. Alright, then we're able to get that air bubble out. We're going to do recap this and take this off. And then I'm going to get rid of this in the sharps. I'm going to keep this by my vial. And then we're just going to do the same thing for furosemide, and we're looking for 40 milligrams, and this is 10 milligrams per milliliter, so we're going to drop 4 milliliters. So I'm going to get 4 milliliters of air and then inject that into my vial. This vial is almost empty, so I really got to get it to the bottom. Make sure I get all medication. Alright. Then we're just going to get the couple of air bubbles out here. Looks like we do, and then we're going to recap this. Alright, and then same thing, I'm going to get rid of this in the sharps container. So now I have my medications, they're all drawn up, and then I have some IV flushes as well. So I'm going to do my second medication check. I'm just going to recheck it against the MAR, and then I'm going to do my third medication check with the patient, providing patient education. So Millie, first I have ketorolac here for you, and this, like I said earlier, this is going to help with your pain. And they're both gonna be given IV, so through your IV site. And then furosemide, this one's gonna help you, it's like a water pill, it's gonna help you start peeing more, get rid of some of that extra fluid, okay? But first, what I'm gonna do is I'm gonna take some of this normal saline, which is just fluids, and I'm gonna check your IV site, just make sure it's patent, okay? And that just means make sure that it's able to flow. And on this dummy, the IV site's actually bent over, so we can't actually push anything. So I'm just gonna, for simulation, pretend that I can push it. All right, so first I'm just gonna scrub the hub for 15 to 30 seconds. Now take this cover off and flush, just checking for patency, which I'm not really able to do flush much. So I'm just gonna verbalize that I'm flushing this, and I'm checking for infiltration, any signs that it's not actually getting into the vein. All right, then I'm going to recap this. So now that I know that my vein is patent here, I'm going to then, first I'm going to give you ketorolac because I know you're having that severe pain, and this will help until I can contact the provider and get you a stronger medication. So I'm just going to scrub the hub again for 15 to 30 seconds, just make sure that both things are sterile. Then I'm going to inject this for 15 to 30 seconds, and I'm just going to verbalize that rate, and I would inject that. And then I can take this off, and this is empty now. And then I want to flush at the same exact rate, and this is just going to prevent incompatibility, meaning any adverse or unwanted effects in the tube. So I'm going to push this at the same exact rate, 15 to 30 seconds, right? Then I'm going to recap this again. And then I want to give you your furosemide next. So even though I hung on this, so now I shouldn't have to re-scrub the hub because I know that this is sterile. I'm just gonna do this one just in case, 15 to 30 seconds. And now I'm gonna push this one over 2 minutes and verbalize that I'm pushing this over 2 minutes. Now I'll take this off again. And then lastly, again, I want to flush this over the same exact rate over 2 minutes. And I'm going to push this over 2 minutes. And then, now that I'm done, I'm going to reclamp this and make sure that this is all connected. And I'm going to give you your call light, see if you need anything else. I'm going to gather my supplies and then leave you in a comfortable position and go document that I gave you your medication. And then I'm also going to contact the provider and see if we can get you a different as needed pain medication. And then,
Okay.
yeah. Oh yeah. Okay.
No, shoot. Hopefully this works. I don't know if we should sit this thing.
Yeah, they probably can't see us if I'll just kneel.
It's okay. Alrighty, so I'm going to be peer reviewing Connor. Connor was very polite and professional. Knew his content really well. You educated the patient really well and talked through every step you were taking to ensure the patient knew what you were doing. I thought it was really good that you caught that she was allergic to opioids, so then you made sure you didn't give her hydromorphone and that you'll contact the provider. That was done very well. You made sure that the patient was safe. You administered the medications at the correct rate and made sure the IV site was patent, which was really well, and flushed in between. Overall, did a good job. I have no feedback, I guess.
Okay,
time.
thank you. Yeah, Paige, you were very helpful throughout the entire process. I feel like you've been good at asking or like answering any questions I had during practice and things like that. And obviously, it's really easy when you know your stuff very well. Like you're very good at calculating the rates, and I just feel like you've been able to help me with anything I've needed. Let's look at this. So based on what you've kind of done, how I approach my next review session would be I think I just want to be very prepared, like, for practice. Even though practice, you don't want to, like, you don't have to know everything. I think it helps doing like a lot of work outside before you come to practice, then you're really ready. And I think that helped me, that you were very prepared. And yeah, thank you.